Please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the call at this time. Thank you. Good afternoon and welcome. I want to acknowledge the land we are meeting on in our different places and pay respects to the indigenous peoples of our respective locations. The earth beneath our feet is their life connection, and I am aware of this sense of belonging. I acknowledge this connection and give thanks to all that the earth provides and pay my respects to the elders. My name is Adriana Marzette, and I am a public health program coordinator with the National Indian Health Board. I will be moderating today's session of the Enhancing Tribal Environmental Health Programs Engagement in COVID-19 webinar series. Today, I am joined by Dr. Anna Rule, who is the Director of Environmental Exposure Assessment Laboratories at Johns Hopkins School of Public Health, and Mr. Mansel Nelson, who is the Program Manager for the Tribal Environmental Education Outreach Program at Northern Arizona University. Their presentation will cover the negative impacts of COVID-19 surface cleaners and disinfectants on public health and the environment. Now, before we begin, there are some housekeeping notes. Today's session is being recorded. If you do not consent to being recorded, you are asked to drop off this call at this time. All participants have been asked to mute themselves. Please leave yourself muted unless the presenter specifically asks you to unmute and engage. However, if you have trouble hearing during the presentation, please let me know by sending a direct message to me via the chat box. We encourage you to enter questions into the chat box throughout the webinar. We will have a Q&A portion at the end of the webinar. If you have any technical questions, please also send me a message. With that, now I will move to read the bios for our speakers. Today we are joined by Mansel Nelson. He's the Program Manager for the Tribal Environmental Education Program at Northern Arizona University for over 23 years. He currently teaches indoor air quality courses to professionals, educators, and students. Mansel completed a BS in chemistry and an MS in chemical engineering. He served in the military for 14 years, working as a chemist and eventually a chemical officer. After his military experience, he taught at Tuba City High School. Oh, I'm sorry, I sound like I'm echoing.
Sounds good.
Okay, let's see. I turned my volume down. I'm so sorry, y'all. He taught at Tuba City High School for 6 years in Northern Arizona on the Navajo Reservation. He explored uranium mining, milling, and solid waste management with his high school students. Dr. Anna Rule is the Assistant Professor, Director of the Exposure Assessment Labs, and member of the Education and Research Center for Occupational Safety and Health at the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. She received her PhD in Environmental Health Sciences and a Master of Health Science in Industrial Hygiene from Johns Hopkins University. Dr. Rule has been involved in exposure science research for over 15 years, focusing on environmental and occupational exposures to aerosols, including biological aerosols. She has worked in industry and academia, served on scientific advisory board for the Maryland Environmental Health Network and the Maryland Pesticide Education Network. With that, I would now turn it over to Dr. Nelson, to Mr. Nelson, followed by Dr. Rule. Thank you.
Thank you for that introduction, and thank you for this opportunity to share a few thoughts with this group. As you mentioned in my bio, I work with tribal staff around the nation on indoor quality issues, and cleaning chemicals is definitely a part of maintaining a healthy school, a healthy home. The organization that I work for, Institute for Tribal Environmental Professionals, serves the 574 federally recognized tribes with training and education and other services. So we appreciate being invited to participate with this group. There's a picture of me, and more importantly, a picture of my grandchildren. I'm a grandfather, and I now have 5 grandchildren. There's one that I need to get added to the slide. In the introduction, it mentioned my academic credentials. I've been a program manager now at ITEP for quite a while, and I spend a lot of my time and energy educating people about a variety of environmental issues, and cleaning supplies, and cleaning is definitely one of them. This picture of me, I'm actually in Alaska, in Anchorage, and the posters and all the stuff that's in display there is about asthma. And that's one of the things that we're very concerned about in using and selecting cleaning chemicals, is the possibility of creating asthma triggers for people with asthma. Brief overview of my presentation. I'll be pretty quick because Dr. Rule is the featured speaker today. But I think partly what I'm supposed to be talking about is the education and outreach aspects. That's a lot of what I do. I work with all levels: school kids, teachers, tribal staff, communities, all with the goal of improving the health of our homes and our schools. So I'll be going through this fairly quickly, but you'll have access to the PowerPoint, and there's some links and things in here I think that you'll find useful. And I'm introducing several EPA infographics. What's already been stated, but I want to make clear, is that there's a direct connection between cleaning and health, and it's not always the connection that people think about. People think I've got to get rid of germs to keep people healthy, but the reality is the cleaning chemicals themselves can damage health. Ingredients in common cleaning chemicals are tied to all the problems on this list. The one that I'm most aware of is asthma, because I'm a person with asthma. And I've literally had to leave school buildings because of their cleaning practices, because it was triggering my asthma. So I'm very aware of this, and I guess I'm a good biological detector to let you know when what's going on in your building is not healthy for people with asthma.
Should have them come here. We should have them come here.
All right, well, I'd be happy to visit. Just send me an email. So historically, CDC made the announcement in April 2021 that as far as COVID, that the principal route of infection was through respiratory, and that secondary was surfaces or objects. Up to this point, there was quite a frenzy about cleaning. In fact, one of my partners and I did a webinar early on in the pandemic about cleaning, and we had over 2,000 people attend. There was high interest. People were buying anything on the shelves, and anything, they seemed to lean more to the more toxic, the better, because they were going to kill these COVID virus infection. But and the interesting thing is, reading the research since April of 21, there's actually reasons behind why they have identified that surface transfer is not as much of an issue. I think one of the key guides that came out during the pandemic was created by EPA. cleaning and disinfecting practices. Their format here is good idea, be careful, and don't do it. And I'm going to go through these briefly, but this infographic is available for everyone, and I'd encourage you to get on the website and get it. And the link is at the bottom of the page there. So I think one of the things I really want to emphasize is soap and water are great cleaners. They remove a lot of the germs and dirt from surfaces. And I like the sentence that says, in most situations, cleaning is enough to reduce the risk. And that's certainly true with the SARS-CoV-2. It's quite vulnerable, and it doesn't take a lot to deactivate it. And cleaning with soap removes it, which is very effective. And I also like to pair that with microfiber. So the EPA guidelines don't mention microfiber, but I'm a big fan of microfiber to enhance cleaning. So most of you are probably aware of List N. That became very popular early on in the pandemic, and people are still relying on that. But I want to take a step further and point out that there are asthma-safe ingredients in cleaners. One of my favorite is hydrogen peroxide. Now, hydrogen peroxide can be hazardous if you use it incorrectly. It can damage your eyes, etc. But the nice thing about it is the residuals are minimal. So it's definitely a preferred cleaner for asthma because you don't have a lot of residual chemicals. And of course, be careful using disinfectants around people with asthma. I visit a lot of schools, both in my capacity to look at indoor quality and for teaching. And I can tell you, talking to school nurses, this is a big issue and a very much of a concern. Of course, I don't have time today to talk about ventilation and filtration, but those are more effective for addressing COVID than cleaning with harsh chemicals. There was also, I saw a lot of people interested in fogging, and there seemed to be a misunderstanding that you could kill the virus in the air with fogging. That is a clear misunderstanding. And in fact, the biggest hazard with fogging with chemicals is then you have potential residual chemicals in the air as well as on surfaces. And depending on what they are, that may not be very good. A lot of interest in UV lights, and used correctly, they can be effective. Used incorrectly, they can be risky and ineffective. One of the things that I've been emphasizing during COVID is air cleaning technologies. And there's been a surge in interest in air cleaning technologies. But working with EPA scientists, I would caution that a lot of these quote unquote new technologies, which are just repackaged old technologies, are not safe and not effective. So there are technologies that are very effective, like HEPA filtration. And that's what I'd encourage you to look forward to. One thing, visiting schools again, one of the things that I observed frequently was children being involved in applying disinfectants. This fits in the category of don't do it. There's lots of reasons why it's not a great idea. And if you read the label on most of these, it says keep out of the reach of children. Well, I would say anyone under 18 should be labeled as a child and should not be using disinfectants. If you want children involved, use soap and water, microfiber. Those are great tools to help kids learn about cleaning. Disinfectants exposure is not one of them. And of course, labels will give you warnings. Make sure you read all the labels and understand them. Reoccurringly, I find that people do not read labels. They're shocked when I have them read a label after they've used the product, they've demonstrated how they use it to me, and I say, okay, you just violated 4 federal laws. Now read the label and tell me what they are. And they find out that they should have washed their hands, there should have been a potable water rinse, they should have ventilated, et cetera, none of which they did, and all of which was in the label. There's also concerns about mixing. So to identify chemicals to use for cleaning, EPA has helped us with the Safer Choice program. When I visit communities around the nation, I go to the grocery store and I find out how many Safer Choice products they have access to. It's been interesting because some of the rural communities that I visit have more Safer Choice products available than some of the big urban areas that I'm in. But Safer Choice is what we want to look at for to help us with products. And notice it's safer. That doesn't mean that you can drink it, that you can spray it in your eyes. It means that it's safer than the alternatives. There's still risk, and we still need to follow labels, and we still need to understand what we're doing. There's also the design for the environment. Again, another EPA program. This is focused on antimicrobial products, which again were of high interest during COVID. And again, I recommend using their label as an indication that you've got a better product. And there's the website linked down at the bottom. And I understand that these PowerPoints will be distributed afterwards. One of the issues that one of my colleagues realized, as did I, because I've been visiting all these schools, was the children using disinfectant wipes in schools. Extremely popular. I've been in schools where every classroom had a case of disinfectant wipes. And so this picture slide is the header of an article that we wrote together, released through the University of Arizona Cooperative Extension Service. And I'll be providing a copy of this to be distributed so that everyone can read it and study it. But basically, it's reminding all of us that children are children, that they have higher risk, and that these disinfectant wipes can be higher risk and should not necessarily be exposed to children. I have some wipes, not disinfectant wipes, but wipes that are pure water, and I like them a lot, and that's what I use. It's like a microfiber type material, and it's got moisture in it, and for a lot of applications that works just great. So education and outreach, which is one of my foci here. Repetition. You got to remember that we're talking about cleaning habits of many years and perhaps even generations. In fact, you know, I've often heard from people, well, my grandmother used bleach, XYZ, to do ABC. If bleach was good enough for her, it's certainly good enough for me. And yeah, well, grandma didn't breathe very well as she got older, and she had damaged lungs and, you know, things like that we want to prevent for future generations. Another thing I've found in education and outreach is providing samples. So people purchase their normal things that they get. They're not so inclined to get, you know, these strange green cleaning stuff or healthy cleaning stuff. So provide samples, let people try things out. In many cases, even the most hard to convince, after they've tried a sample, realize that the alternatives work, then they're inclined to continue that. Involve administrators, and school nurses love it when you come to talk to them about cleaning supplies and avoiding asthma triggers amongst children. And in homes, strong health messages can be useful. We're focusing on the children. We want them to be healthier. And particularly where we see high rates of asthma, especially in tribal communities, I try to, part of my message to any home that has anybody in it with asthma is we got to look at cleaning practices, and that can help folks with asthma a lot. There's my contact information. I welcome contact from anyone in tribal communities to work with them to improve the health of their communities, both in schools and homes. And thank you very much for the invitation to be involved here. And I look forward to learning some things from Dr. Rule.
Thank you, Mr. Nelson. I think I am going to disappoint you. I don't know that you're going to learn anything from me because you already covered everything that I was going to talk about beautifully, but I will do my best. Let's see. I'm gonna actually zoom through these because honestly, they are very, very repetitive. And so I would like to leave some time for questions. But I wanted to talk about exactly the same thing that Dr. Mandel has used, that Mr. Mandel has used, has talked about the negative impacts of COVID-19 surface cleaners and disinfectants on public health and the environment. And so I think everybody right now is very aware, but we know that the virus is transmitted primarily from one person to another. You need to have an infected person in order to have an infection in the room. And so as has already been explained, there's many ways that we can be infected. Three main ways that have been recognized are through very close contact with another person. So when you have somebody and the droplets are impacting that other person directly. The second one is through fomite transmission, what we call when these droplets that are expelled from people fall into surfaces, or maybe you cough on your hand and touch another surface, so you now the infected droplets are in the surface, and the aerosols. And to date, we know, and CDC has recognized that even though we know with certainty what is the relative importance of the three modes of transmission are probably happening, we know that the aerosol route is the more important. And so I just want to reiterate, and it has been said already, but fomite isn't thought to be the main route of transmission. There's a long chain of events that need to happen, right, for you to be infected if you touch a surface. So first, the droplet that fell on the surface needs to still be infectious. When you touch it, you need to happen to touch one of the infectious droplets, and then touch your face, some part with a membrane, like your eyes or your nose or your mouth, with that part that contains the infectious surface. It's very, very, very low probability. And the fastest, easiest, best way to kind of like break that chain of transmission is by washing your hands. Washing your hands or putting some alcohol disinfectant in your hands is the most effective way. Of course, you can also clean the surfaces. I'm not saying that that's not a thing to do, but somebody can cough on top of the surface 2 seconds after you have disinfected the surface, and it can be infected again. So washing your hands and ventilation are the best ways, like we already heard. So quickly, I mean, you already heard that the viruses have these membrane that surrounds, that keeps the virus together. The membrane has like an oily lipid constituents that hold the spike protein attached to the genetic material, which is what the virus needs to infect the cells. And there are many ways to inactivate the viruses, but most of them are inactivating the membrane that holds the virus together. So I'm going to talk about those very briefly because it has already been said. So soap, how does soap work? Soap is To me, the best option, because it's cheap, it's very available, it's easily available, it doesn't really leave a lot of residue, and the health effects are very, very low. Maybe they dry your hands, but that's about it. And so soap has these molecules that have a part that depicted here as this blue head that is attracted to water. And the other is like a tail that is very attracted to lipids or fats. And so when we use the soap with water, these soapy molecules go and try to attach to the membrane that is made of lipid molecules, and the soapy, the water, the head of the soap molecules is attracted to the water. So these there's like a pull from the water brings apart, or this deactivates the virus. It just cannot hold together. And once you expose the genetic material and break the virus, then it's not infectious anymore. So alcohol is also a very good disinfectant. Hydrogen peroxide and bleach, I'm going to talk a little bit about each of those, and quaternary ammonium compounds, which are the main concern of my talk. Like has been said already, alcohol typically at about 70% is the best dilution for disinfection. Why 70% and not more? You know, some people think if 70% works well, maybe 100% alcohol is better. It turns out that 70% leaves some residue and lets the alcohol a little longer before it evaporates. And this contact time is actually what inactivates the virus and some bacteria. And so it's important to keep that in mind. And there's a reason why we say 70%. But it's flammable, and it needs to be well sealed so that it doesn't evaporate, because if it evaporates, it's less efficient. Then hydrogen peroxide, only a 3% dilution is enough for effective disinfection. And so that with 8 minutes of contact time, so that you need to the surface and you need some contact time to deactivate the virus. But it's relatively safe to be used alone. It is an inhalation irritant, so it has to be used carefully, just like bleach. And but there's no residue afterwards, so it's very safe for the environment. And it also shouldn't be used with other cleaning agents, just as bleach. So bleach is it's also very readily available. Everybody knows that it's a very effective disinfectant. However, it's a very strong irritant. And so like Mr. Mandel said, it has to be used carefully and in a very well ventilated area. It can generate toxic fumes, and if you're asthmatic, it's very you can have a strong reaction. So that brings me to the other kinds of chemicals that have been used during COVID. And most of them, and I'll talk a little bit about this, but most of the chemicals in the list N of EPA actually contain these quaternary ammonium compounds. That is a whole family of chemicals. It's not just one chemical or two chemicals. It's many chemicals that fall under this umbrella that we call Quats. And they actually don't just disrupt the membrane. They actually penetrate the cell, and they have their active mechanism inside the cells. And these are inside any cells, right? They are called biocides, so they kill life. That's the main way that people refer to these chemicals. And so, intuitively, we can tell that that's probably not a great idea, because we are also, conformed of cells. These chemicals are chemically designed to stick to surfaces. That means that they're designed to persist in the environment. They are really hard to eliminate from the surfaces, and they therefore you keep getting exposed to them when you touch them or when you inhale them. And they have been associated with many health effects. Amongst them, exacerbate asthma and other breathing conditions, and They also irritate the skin. They have been associated with rashes. But they also, in their environment, they have been found to be lethal to aquatic organisms. So when they enter the rivers and streams, they are disrupting our environment. The other thing that's important is that they have been also found to impact antimicrobial resistance to some of the organisms, viruses and bacteria. And you don't want that because then they become more complicated, more difficult to clean. Oops. So these quats or quaternary ammonium compounds also have been found to have reproductive effects. And this is kind of like an interesting story. Some investigators that were using mice for the research moved from one university to another. And in the new university, they started to find that their mice were not reproducing as much. And so when they started to investigate what was happening, they suspected that it was something in the environment. So they looked at the air, the food, the water. What are we giving them the mice that is different from the previous university? And they found after many, many months, probably a couple of years, that it was the cleaning practices. They were cleaning the cages of the mice with these quaternary ammonium compound cleaners, and they started to do like a little experiment. Let's see if by eliminating these cleaners, we can bring the mice to reproduce back again. And they did. They found that eventually the mice started reproducing, but only after many, many months. So they say in their paper, it took months to re-sanitize the animal cages with quat-free substances until the mice were reproducing normally again. So this is concerning because the reason we use mice in research is because they reproduce very quickly, right? In 20 days or 30 days, you have a new litter. And so that this gives us a very good model for reproductive effects. We can't do that in humans because, we don't know, in 2 or 3 generations, what is going to happen with the exposure that we're having right now. It takes a long time. And so because these quats linger on surfaces after they have been cleaned, there's a continuous exposure that we have. And this is especially important, like Mr. Mandel was saying, because of the kids doing it. You're exposing them when they're very little. And we are reapplying them, sometimes multiple times a day, which is completely unnecessary. These investigators that found these effects in mice also started doing some research in humans, and they recruited a small sample size, only 43 volunteers, but they found 80% of those volunteers to have quats in their blood. And the people that had higher concentrations in the blood had higher of the early effects that they were finding in some of the cells of the participants. And these effects are decreased mitochondrial function, increased inflammatory cytokines, and disruption of cholesterol equilibrium. And all of these are just early indicators of health effects. They're not going to kill you immediately, but it means that there's some effects that are happening in the body. And so, as already established, I think we are abusing disinfectant use, especially because soap and water is so effective. Very quickly, just going to reiterate about the list N from the EPA. An important thing that people don't realize is just because it's in the EPA, it doesn't mean that it's safe. It means that it's effective at killing the virus or deactivating the virus. But these chemicals are not tested for pre-market, they have not gone through pre-market testing for their safety in humans. There's just no time to do it. It's very, very time consuming and expensive to do these tests. And so yesterday I checked the list. There were 602 products. 278 of those products have quaternary ammonium compounds. 495 of those compounds are classified as increased risk. And importantly, soap and water are not on this list. It's not clear to me why. I have already asked a couple of EPA people, why isn't soap and water in this list? People could use them. anyway, I have a couple of resources for you. One is this new, relatively new list that has been published by a nonprofit organization working with many, many volunteers, and it's called saferdisinfectants.org. I really, really encourage you to go find this. It's really easy to use, and it's based on the list N of EPA, and it like classifies the compounds that you find in that list and lets you know which are safer. So you can see here this morning, this is from this morning, there were 62 compounds in the list N of disinfectants. 103 of them are some of the safer, like based on hydrogen peroxide or alcohol or acid, what's called vinegar, and 495 have increased risk for one reason or another. And for example, bleach is part of those that are at increased risk because it's a strong irritant for the health, respiratory health. Another good resource is this Maryland Pesticide Education Network. Even though it's based in Maryland, it's actually, the resources are good for anybody in the United States and in the world. There's very few, I haven't found anything else like similar to this resource, and they have really nice, have compiled into very short like resources like this one. This is for healthcare facility. They have another one for schools, and they list some of the things to avoid, what kind of products to avoid, what to look for in the label of your product if you find these ammonium carbonate or ammonium bicarbonate. Sounds like many other products that we use, but they are part of these quaternary ammonium compounds that we want to avoid. And they give you some links on how to find safer disinfectants. So I encourage you to find these resources, and I can make these slides available also. I completely agree that these foggers and sprayer technologies are completely unnecessary. They are used widespread. They are designed to create an aerosol that stays in the air and is a potential irritant. They will not clean the air. Only ventilation will clean the air, and HEPA filters, and a good way to make sure that you have clean air in and dirty air out. Fogging will not clean effectively a surface, and it creates a false sense of security. So I just reiterate that. I am going to, there's this case study, but I'm going to really quickly go through it because I want to leave room for questions. There was, in this school, there were several children with asthma that had improved during the COVID forced, stay at home directives. And the moms were really encouraged, like, oh, this is great, my child is feeling better. And as soon as the kids went back to school, they started to have these asthma symptoms again. So they started to investigate what is happening, what is going on in the school. And they found that one of the culprits was that these cleaning products. And like Mr. Mandel mentioned before, the teachers were asking the kids to use the cleanings on their desk, the cleaners wipes on the desk. So a group of concerned parents went and requested the school board to eliminate these wipes. They were called Virex. I think it's the same product in the United States. I'm not sure if it's widely available, but and they were proposed to use this other product, Oxivir, which is made of mainly hydrogen peroxide. And unfortunately, the parents got a negative response. The school board said, no, we consulted with some experts. They said no. And so they called me to see if I could help them to understand this memo and what they were saying. And so some of these points of the memo are in blue and my response is in black, right? So the first thing they said is Oxivir contains several more chemical components than Virex. Yes, but none of those extra chemicals are quaternary ammonium compounds. So all of the extra chemicals are very safe chemicals. Oxivir products have a pH of 3.3, which is equivalent of battery acid. So pH alone is not an indicator of toxicity. As an example, the pH of orange juice is 3, the pH of vinegar is 2. So we can see from that this pH reasoning for rejecting the product is not reasonable. They were also claiming that the human body is 7.4 pH, and the solution of this Virex quad cleaner is 8.8, closer to soap. True, but just like the low pH, also high pH has nothing to do with the fact that it is safe or non-safe. Bleach also has a high pH, and bleach we know is an irritant. And the other point was that spray bottles use hand pressure, and therefore they cannot release really small droplets, which not true. Any spray bottle releases all of the sizes of droplets, and some of them are small and can stay in the air, and you can breathe them. And so concerning, I think, is people that are most exposed to these chemicals are the people that use them the most. So healthcare facilities, all the cleaning staff, but also healthcare workers that clean their personal protective equipment. In schools, like we were saying, janitorial staff are very exposed, but also children and teachers if they are asked to use these wipes. Public transit workers, food workers, work and home. So a couple of final considerations. Children are uniquely vulnerable to chemical exposures. Because of their size, their physiology, and their behavior, they are more heavily exposed in proportion to their body weight. And they have more years ahead of them in which they may suffer long-term consequences. Also, it's important to keep in mind the environmental contamination, because like I said before, EPA has recognized the toxicity of these compounds, these quad compounds, for the aquatic environment, and has advised against the release into the lakes and other waters. And when we're overusing these compounds, they're putting on surfaces, and then we're cleaning the surfaces, and all of these compounds are going into the water. Eventually, the treatment plants are not designed to clean or retain these products, so they are going on to other waters, and eventually ending up in food or water that we drink. So more exposure to the people. And so one of the ways that we can reduce exposure is ask, is it really necessary to clean? As we already talked about, surface is not the main route of exposure for the virus. So maybe healthcare facilities and food processing plants or places is important to clean surfaces, of course. So if you need to clean the surfaces, use a less toxic product. Like I was saying before, why not soap and water? Soap and water works because you clean the surface and you eliminate the virus and you kill it all at the same time. So again, here's that same link to the saferdisinfectants.org. So to give very good resources. And with that, I want to thank you everybody for inviting me and open to questions. And I'm going to stop sharing so that we can see you guys.
So before we go into the questions, I would just like to ask Dr. Rule, Mr. Nelson, can you just clarify the difference between cleaners and disinfectants before we go into the question? So just to start off there, and then I will go into the chat box and start reading those questions.
Dr. Rule, I'll let you take it. You probably have a more technical definition.
Well, no, it's probably the same as yours. Is this cleaning is just referring to a physical way of removing from a surface, and disinfectant has that additional effect of inactivating the organism. Do we agree?
Yeah. Yep.
But some cleaners are also disinfectants, and not all disinfectants are cleaners.
Right.
Okay.
Yeah, that's one big misnomer or misunderstanding. I see a lot of people using bleach as a cleaner, and it's not a cleaner. It's not gonna, it doesn't have surfactant in it. It's not gonna be more effective for cleaning. In fact, if you use a disinfectant on a dirty surface, it's gonna be much less effective. So there are some subtleties that people just aren't understanding. And of course, Dr. Rule and I have a lot of work ahead of us to help everyone know about these things.
Okay, so I just want to go back, just want to make sure we address it. Earlier during the webinar, there was the question in the chat box, is baking soda and vinegar safe for cleaning and disinfecting? So Mr. Nelson, do you want to reiterate your answer from earlier?
Sure. One of the things I want to be careful about is the difference between safe and safer. A lot of chemicals, including baking soda and vinegar, can be hazardous if used improperly. Or, for example, I've seen them used to blast off rockets. And if somebody's standing over the rocket when it's done, then it's hazardous. Of course, even water can be hazardous. So I just want to emphasize that we need to be respectful of all the chemicals that we use and thoughtful about them and use them in a safe manner. But that said, baking soda and vinegar are very common green cleaning chemicals, often recommended. There's lots of recipes out there on the internet. And I definitely endorse them. The interesting phenomenon I see is most people still want something they buy commercially at the grocery store, you know, in a spray bottle or something. But I definitely endorse baking soda and vinegar, used carefully, correctly. I think they're great.
So the next question is a two-part. So the first part says, can you give an example of a quat? That was doing your presentation, Dr. Where you were talking about the different quats. Can you give an example of a quat compound? And then the second part of the question is, when you say soap, do you mean detergent, or could it also be like Dawn dish soap? Like, how do you define soap?
Dawn dish soap is detergent.
Oh, okay, yes, okay.
Difference between soap and detergent. So I'm asking, when you use the word soap, are you including in that detergent?
Yes. Yes, we are. And some examples of these quaternary ammonium compounds are, usually you will not find the word quaternary ammonium compound usually in the label, but you will find, for example, let me see, benzalkonium chloride. That is a very common one. Ammonium chloride. I can put a list. Those are the main ones that come to my mind right now.
Next question. Can you speak to the dangers of using essential oils?
Well, Dr. Rule may have more to add, but I can tell you that as a person with asthma, there are many essential oils that trigger my asthma. My brother used to sell them door to door kind of thing. And I managed to get a whiff of one of his products and I was sick for the rest of the day. The problem with the category essential oils is that's literally thousands and thousands of products, all of them with different characteristics, different smells, different reactions with the human body. I would not endorse essential oils for anything. If you are interested in a specific essential oil and do your research, you may find some that even have therapeutic effects. But I do not endorse all essential oils. And I know for, in my case, that some of them are deadly for a person with asthma. And I'm sure you might have something to add to that, Dr. Rowe.
No, actually, I don't have anything else to add. I agree completely. I agree completely. Not all oils are created equal, and you cannot just make a big, statement. But a lot of them are irritants, and they can be very dangerous for people that are sensitized. I mean, if you're okay with essential oils and they don't produce an effect on you, that's one thing. But I don't think they are used as cleaners or disinfectants in general.
Yeah, I was gonna say some people add them to cleaners. The other place I've seen them used is in school classrooms, which I try to shut down really quickly, because even if the teacher tolerates it well, you've got somewhere between 30 to a couple hundred kids coming into that classroom, and inevitably there's going to be some that don't do well with that particular essential oil. And that's where the danger escalates exponentially when you're working in a school environment.
The next question. So earlier when we started, you said that not all cleaners, the question is, so what is an effective cleaner that also disinfects? A 2-for-1.
I think soap and water, because with soap and water, you need to first do this physical, removal. You have to do the physical thing of actually cleaning the surface. And the soap and the water actually have surfactants and other components that will actually remove the dirt and the organisms from the surface. And in the process of doing it, you're also surrounding those viruses with these soapy molecules that will attach to the membrane and to the water and disrupt the membrane. And so you're inactivating the viruses at the same time that you're cleaning the surface. So soap and water comes to mind. And I think alcohol is also considered one of those that can clean and disinfect. Of course, alcohol is very, very harsh on the skin because it dries out the skin. So that's a thing that to be considered if you have, sensitive skin.
Okay, so this is a question, Dr. Nelson. There was discussion in the chat earlier about hydrogen peroxide. I know you two addressed that earlier, but here's another additional question. Does hydrogen peroxide get rid of mold?
Well, I want to go back to what Dr. Roll said. Soap and water is great stuff, and it works for mold too. With mold, you want to remove it is really what you want to do. And in fact, if you just kill mold, leave it on the surface, then you're actually creating another hazard. Because mold, as it dies, will release its spores, and that's one of the hazards of exposure to mold. So I wouldn't recommend hydrogen peroxide for mold. You don't disinfect mold, you clean mold. And you remove mold and you remove the moisture source. And I do hour, 2 hour, 6 hour presentations on mold. So we don't want to get started on that at this moment, but just to say that there's a lot to understand about mold, and I definitely don't recommend hydrogen peroxide for mold.
Okay, yes, sir.
Right.
And Dr. Rue, would you agree with that, not using hydrogen peroxide on mold?
I agree that with mold, it's a whole different beast. You have to remove it, physically remove everything, and you have to, more importantly, find the source of the moisture and eliminate that source, because otherwise it's going to keep coming back and back. It's a very efficient replicator. It has a way to come back, and especially in places that are humid. We have a lot of that issue here on the East Coast.
Next question. Can you expound on air cleaning products that use hydrogen?
Yeah, hydrogen peroxide. That is one of the questions that I have worked on. One of the first things I want to point out is there's a big difference between chemical on a surface and chemical in the air. Something that might be a safer choice for a chemical that you're going to use on a surface as a disinfectant is way different than a chemical that you're going to put into the air. And as a chemist and a chemical engineer, I can tell you that's true for practically all chemicals. Just another one, bleach, for example, we've kind of said that maybe we want to minimize use of bleach. It's not a cleaner, it's a disinfectant, but bleach, and really what we're looking at is chlorine, is very effective for disinfecting water. In fact, most of you are drinking water that has quote unquote bleach in it, chlorine in it. But that doesn't mean I want to breathe it. So that said, I've actually done a little bit of research on hydrogen peroxide, and I have my concerns because hydrogen peroxide is an irritant to the lungs. Although I have read research papers where they've been using hydrogen peroxide, what they call dry hydrogen peroxide released to the air to disinfect air and surfaces, but I have real concerns about it. It's one of the devices that produces dry hydrogen peroxide that I've recommended the EPA investigate further, but they're just getting started on their research. I personally would not use that product, but at this point, I don't have a lot of research on my side that says this is why you shouldn't use it, other than hydrogen peroxide is an irritant.
Right. The products that use hydrogen peroxide for air should only be used in a very tight, no human exposure, only a room for they were using them in hospitals at the very beginning of the pandemic to disinfect like masks or personal protective equipment. But it's very highly, yes, people should not be breathing hydrogen peroxide, that's for sure.
Yeah, one of the things they do is these devices that produce hydrogen peroxide, it produces it in very low levels so that people don't die immediately. But it's also not terribly effective when it's in these very low concentrations. So I go back to a lot of these unproven technologies and can make a general statement that I would encourage people to look at HEPA filtration. Activated charcoal are well-established, well-researched, well-understood for cleaning air. And everything else I would look at with a great deal of skepticism. UV is another one that is well-established, but it needs to be implemented correctly and engineered correctly to be effective. Many of the devices that they put UV lights in, I'm not sure come even close to proper use. I'm pretty skeptical about their applications, but I know UV can be used very effectively. But all these other new technologies, so-called, I'd be very cautious about, and I personally will not use any of them until they're proven by an independent source such as the Environmental Protection Agency.
And our last question before we wrap up. Can you please describe how you would clean tabletops? What is a clean tabletop best practice with soap and water? How would you clean tabletops?
Well, I have a quick story, and then I'll turn over to Dr. Rule to answer the question, but methods do count. We have what's called best practices in a lot of different areas of science and such. I was talking to an administrator in Alaska whose child came home from school smelling like ammonia. And she asked me, should my child smell like ammonia coming home from school? I said, no, of course not. So they got me the phone number to the Head Start administrator, and in talking to her, she was very defensive. She told me how she was required by policy to clean tables with ammonia. But I started getting into the details. Well, where are the children while you're disinfecting? Oh, they're sitting at their desk. And and as she described the process, the staff member is on the opposite side of the desk, spraying with a sprayer. Yeah, Dr. Rule is cringing. And I could see the droplets of ammonia bouncing off the desk and landing on the poor children. And I said, you know, we can disagree about a lot of things, but let's agree that the children should not be directly sprayed with ammonia. Best practices matter. So the question is really a best practice about using soap and water. And Dr. Rill, do you have thoughts on that? If not, I have at least a couple ideas.
Yeah, no, I mean, other than just make sure that you cover the whole surface and, you know, maybe do horizontally and then vertically, and then make sure that you rinse with water. I mean, other than that.
Well, what I would add is one of the concerns with using soap and water is somebody has a bucket of soapy water and one microfiber cloth or one rag, and they drag that around the entire building. That is not a best practice for cleaning, believe me. You want to regularly change out your soapy water. And if you're using something like microfiber, I recommend a dozen or more microfibers per classroom, and changing those out frequently. And I have seen people give demonstrations where by folding the microfiber in eighths and then folding and refolding, using a different surface on each desk, because poorly done soap and water could actually end up transferring stuff from one desk to another, one room to another, and we don't want to do that. So using lots of cleaning cloths, whether it's microfiber or other, and frequent cleaning of your water, your soapy water, will help lead to better practices for cleaning the soap and water. Some great questions, by the way. Thanks everybody for asking all these great questions and thinking about what you're doing and what you're being exposed to in your homes and schools and workplaces.
And so just to like touch on a comment, and I saw Dr. Rule, you addressed it in the chat box. There was a comment that talked about while soap and detergent may destroy the COVID virus, it would not disinfect or destroy other microbes such as bacteria. So Dr. Rule, would you like to address that comment? I know you replied to him, but would you just like to address it overall one last time, and then I will wrap up.
Yeah, so soap and water can be used as a cleaner, like we were saying, but not necessarily disinfect every single microorganism, but it does help disrupt the membranes of many organisms. But actually, the same can be said for alcohol. The same can be said for the quaternary ammonium compounds. They are very effective on some organisms, but not every single organism. So this has to be on a case-by-case basis. Bleach is one of those that is so aggressive that it will actually disinfect a wide range of virus, bacteria, mold. But it is very irritant. It has to be used properly, cannot be combined with other cleaners. And so it has to be used carefully. But yes, I agree. It is not like all works in all things, but if you're careful, it can work for many things as a cleaner.
So I see the comments are coming in. So in NIHB fashion, at this time, will all of the attendees please help me in thanking Dr. Rule and Mr. Nelson for coming. Let's use their reactions and show our presenters some love and just let them know how you feeling. As y'all can see, you got some hand claps, you got some celebrations, you got some love. You know, we really appreciate you taking the time to come and join us. I would echo what I just saw in the chat box. Your presentations were very clear. You really engaged your participants in the chat box in your presentation. It was absolutely fabulous. And I just thank you both for making the time to join us. And then also to the attendees for asking your questions. For everyone that sent me private messages, if I forgot to ask your message, please tap me. I will download this chat box. I will send those questions to you, Mr. Nelson and Dr. Rule. So if I miss anything, I can include those when I send out the presentation and the recording. And to answer that last question that I saw, yes, sir. All the presentations as well as the recording I will be emailing them to you on Thursday. I'm out of the office tomorrow for a training. So as soon as I'm back in the office on Thursday morning, you should receive those slides and the recording by 12 noon Eastern time. If there is anything else, again, I just want to say thank you all for participating. A big thank you to our presenters. Please take the time to present, to complete the evaluation. There was a question about mold. Please note that the next webinar is April the 27th at 4 p.m. and the topic is healthy homes. And we're going to have EPA with us. So no better time than to quiz them on mold and to ask about the financial resources to really address it and get rid of it. So again, thank you all. Appreciate you. Please do not hesitate to reach out to me if you have any questions. I will include the contact information for Dr. Rule and Dr. Nelson if you have any questions for them. Again, thank you all and have a blessed evening, afternoon, and drink your water, get some sunlight if it's out today, and just smile and have an awesome day. Bye-bye.
Thank you. Thank you, everyone.